Dr. Ramasubramanian, and I think, with this huge numbers that we are facing of number of people suffering from mental health issues and the incidence and the prevalence rates that we talk about, how do you think that we as a nation, we as a society, or an emerging economy, the kind of lifestyle changes, how is it impacting people in mental health in general, and how is it as compared to other developing countries? What is the scenario in India in general, and how do we fare as compared to people in similar such societies?
So thank you, ma'am, for giving me an opportunity, because this is one of the important, very sensitive topic, and also this problem is going to pose a major challenging task for any government in the coming years. In the mental health scenario of this country is very gloomy, and as our president has highlighted, 3% of the population is suffering from the serious type of psychiatric illness who are dangerous to themselves and who are dangerous to other people. I am not talking about the minor type of psychiatric illness. If you are going to involve the minor type of psychiatric illness, almost 30 to 40% need psychiatric intervention. And for such a huge type of population, you can calculate the population of our country, 121 million, and you can calculate 3%. So you can imagine how many people are need the psychiatric treatment, who are in acute need of the treatment. For such a huge type of population, if you come across the infrastructure facilities, again, it is a very gloomy situation. In our country, we have got about 42 mental hospitals. And again, the private sector, we have got about 20,000 20,000 beds. And about the manpower, in the entire country, we have got about 5,000 psychiatrists, 2,500 psychologists, and 1,500 psychiatric social workers. So, on one side, the need is more. The other side, the service is less. Why I am stressing this important point is, in the past 20 years, there is a silent revolution is going on in the field of psychiatry. All psychiatric illnesses treatable, curable, and to some extent, it is preventable. Yet, if you identify the illness very early, if you initiate the treatment very quickly, and especially if it is coupled with proper rehabilitation, I can boldly tell that the recovery will be total. But the sorry state of affairs is, most of the individuals, whether they are upper class or lower class or middle class, whether they are educated or uneducated, they are not aware of the psychiatric illness. And because of the ignorance, lack of manpower, lack of infrastructure facilities, a treatable illness becomes an untreatable. A curable illness becomes an incurable. An acute illness becomes a chronic illness. See, that is why I was very keen, when Karthiyan sir, when he mentioned about this program, I was very keen to attend this program because we want to sensitize the common public. After this seminar, if you are able to identify the illness, if you spread this message, if you are able to save at least one person, we are the most happiest person. So the awareness, it is the most important thing.
Thank you, Dr. Ramasubramanian. I just move on to Dr. Prasad Rao. And, in any given society, we readily identify that there are certain vulnerable populations. Some people seem to be more at risk for mental illness than other people. And if you look at it, it is the children, the women, and the elderly, and each constituting a huge chunk of our population who are more at risk. So what makes these special populations more at risk, and are there some kind of protective factors or risk factors that make them? And can we identify them? Can our families learn to identify them?
Thank you, Sujata. First of all, I wish to thank on behalf of Indian Psychiatric Society to dear Karthikeyan for inviting us to share with the elite of this capital the mental health issues, which I think already Karthikeyan sir has really brought out some of the things. Only thing I want to start as the president of Indian Psychiatric Society. I also have to my left both who are presidents of past presidents of Indian Association of Private Psychiatry. Two important facts. First, the psychiatric services across the country, the total number is increasing. Psychiatrists are probably now reaching around 6,000, but majority of services are done in private, and if you take the ratio, it is 70 to 30. 70% of psychiatric services are given by private. Now, coming to the three vulnerable groups which Sujata has brought out, all the three are vulnerable for various reasons. First, the extremes of two age groups, the children and adolescent, which roughly form around 18% of this population of this. They are more vulnerable than others. And there are enough reasons to start with. Apart from talking, the previously protected joint family system is no longer there. The family is now shrinking very badly. And among the shrinking, both the parents, if they are working, the time spent, the quality time spent with the child is gone. Today, probably a child would receive an iPad by the end of 1 year, so that the child no longer disturbs the mother who has to do a lot of other responsibilities. There starts the less emotional interaction, and it starts with the growing up. As the child grows up, there are other pressures which come. The child is put into the school by the age of 2 years or 2.5 years, whatever the name of the school, play school, nursery, UKG, LKG. And the quality time and the play, which I think most of us sitting on this dais would have enjoyed during our childhood, we were forced to go and play between 4 to 6 by our parents. Now, most children do not have. There starts emotion. Then the competitiveness, the exam stress. Right now, as child, at the age of 10 years, is decided by the parent that he would join the so-called concept school, where he's pushed to either engineer or a doctor, because there are only two professions which parents, in general, I'm talking about a very large population, though I'm generalizing. There are only two courses, one is the maths course and one is the biology course, and they decide way back at 10th year. So these are the pressures of the day. In fact, that is one important reason why the suicide rates are maximum in the age group of 10 to 25 years. In fact, suicide has two different peaks in this two vulnerable group. We are talking about the child, we are also talking about the elderly. Then we are also talking about women. Now, women is now, today's woman is very, 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 I would say, encouraged to go and become independent, learned and all, but she also carries lot of other emotional issues which is going on in the changing society. And in general, women are more vulnerable because of their own sexual hormone state, which causes the mood changes. Now, I will take only 1 or 2 minutes to just explain the two important examples. A child who is doing very well at home but doesn't perform in the class is one child which is neglected. That's called specific language disability. This is as opposed to mental retardation. Mental retardation means they have some problem with the brain cognition. Here there is some specific problems. And the second important thing in a child probably is the ADHD, what is called attention deficit hyperactivity disorder. Coming to the geriatric age group, the most difficult age, 6.7% of population is above 60 right now in our country, and it's growing very fast because the life expectancy is growing. And this group, especially of 60, again to the changed society, now it is more of an empty nest. Most houses, the children are well settled in either US or in some other place. The parents alone stay. And remember, above 60, a typical person average takes about 6 to 10 tablets per day. They are already prone to diabetes, hypertension, and comorbid medical disorders. Depression is one which comes there as you grow older. There are dementias. So if you keep on talking, there are enough. But women on one side, children and adolescents on another, and then geriatric, all are vulnerable in one way or other.
Thank you.
But I would like to end with a thing that, as already highlighted by Ramasubramanian, I think psychiatry, when I joined psychiatry, we had only about 10 medicines. Psychiatry is a branch of medicine, and psychiatric disorders is the disease of the brain. So today, thanks to the technology, PET scan, MRI, you know very well, if a person reaches the hospital after a chest pain within 6 hours, we can actually dissolve the clot. I wouldn't claim so rapid changes occurred in psychiatry, but today's modern psychiatry is much more beautiful in terms of getting the results. And one last point, the stigma when I joined in 80s, it was there. Today it is vastly reduced, but I still think that we should take the society forward in reducing the stigma of coming to us. In fact, children, very young children are being brought to us by the parents recognizing. So the recognition of the disorders and recognition of the care has further improved. Thank you.
Thank you, Dr. Prasad Rao. Yes, I think the stigma is finally seem to be reducing at different levels, and what you say is so true that even young children are being brought forward by their parents seeking help and counseling. That's a very encouraging pattern of perception of mental illness and mental health. So just moving on, I'd like to next address this to Dr. Rajesh Nagpal. Dr. Nagpal, we keep hearing about this mental health, mental illness is treatable. So there are words like treatable, curable, manageable. So there's a lot of confusion, I think, in the minds of people that what is treatable, what is manageable, what is curable as far as mental illness is concerned. And if you can throw some light on, whether we have really come far, whether we are anywhere near curing anything, what are the kind of illnesses that could be treatable, curable, manageable, that would, I think, enlighten our audience and clarify these concepts a bit.
Okay, thank you, Sujata. Mental illnesses per se are treatable in most cases, curable in about 5 to 7% of severe mental illness and about 20% of minor mental illnesses, and manageable in a good 40% of cases. The issue is that when a person comes to me for a severe mental illness the first time, a young boy of say 24, he's had a serious breakdown, he's going into psychotic illness, the illness is already 3/4 over. The brain has been changed completely in this illness, which has lasted at his house for only 2 days. The illness has begun sometime around the age of 12 or 13 years. When I begin intervening with my treatment process, the illness is almost taken out to its chronic course. That is our biggest challenge today. The second challenge is to identify them before the illness begins. And for that, a lot of research is going on. The other area is that when you start treating them, then there are modalities available in the Indian context, affordable context, by which we can promise that a person who is functionally not very effective in terms of taking care of personal hygiene, in terms of aggression, violence, can become manageable. With modern techniques of rehabilitation, even a person who's grossly disorganized, we can bring him to a level where he can start taking care of himself. Modern treatments today involve not just medicines, but specialized psychotherapies and stimulation therapies, which would mean right from the olden electroconvulsive therapies or ECTs to now RTMS, vagal nerve stimulation, transcranial direct stimulation, and a host of other techniques. So the future certainly is very promising. But remember that the first statement which Sujata made was mental illnesses are treatable. In some parts, curable. In some parts, manageable. But essentially, a chronic illness requiring chronic care. What we do not know is, how do we not get mental illness? How do some of us face horrendous stress and yet not fall mentally ill? Our entire focus is on those who fall mentally ill. That is the next new promising area of work which is now going on. How people can manage to stay say in Kashmir and not get mentally ill there and remain completely fine. We do not know the factors which promote resilience.
Thank you. Thank you so much, Dr. Nagpal. We'll come back to some more on those issues again. My next questions are addressed to Dr. Avdesh Sharma. So, Dr. Avdesh Sharma has been very much involved in the public education platform and in the mass media. So I would like to know that, what would be the goals of such educational campaigns? Have we moved beyond the level of just creating awareness? Are there some specific strategies, some campaign directions that we need to give our public education program? Because I think this is such a vital part of any public health initiative, is to create public education. So what is this crucial role? And also, can we think of public education in terms of preventing and promoting mental health rather than focusing on only creation of awareness on mental illness?
Thank you, Sujata. First of all, thank you, Mr. Karthikeyan and Belinda, who conceptualized this program. I think this question should have gone to Sujaya ji when she was in the ministry. Yes, there should have been a planned focus. Yes, there should have been public-private partnerships. Yes, there should have been differences between different kinds of mental illnesses and how to early identify and how to prevent and how to promote health rather than prevent illnesses. It hasn't happened. And I think it hasn't happened because somewhere the public at large did not become a part of the whole movement. I think mental health is too important to be left only to professionals. Each one of us who's sitting here, including us, because we also at the end of the day are prone to, especially when you hear people out for 10 hours a day, prone to develop certain kinds of psychological issues. What do we do with what we see around us, and what do we do when we have our own negative emotions should have become a part and parcel of right from childhood as a way of living and not beyond when somebody has fallen sick. As Rajesh pointed out that if we are able to pick it up early on, which means very early you are able to help a person, the long, over a period of time, kind of disabilities that happen to people. And I'm not talking about disabilities only emotionally, although that's the biggest one for the person and the family, but in terms of the man days lost, in terms of economic, in terms of financial, in terms of occupational, physical, because now we are seeing a large amount of interface between physical illnesses and mental illnesses and interpersonal. If you actually were to see the word healthy, it comes from heal thy, which means right from the beginning, if we want to prevent illnesses at one level and make people feel the sense of well-being, which is an essential part of the WHO's definition, then that can only happen when you empower the people. Now, at this point of time, I think we are empowered enough, although I think that in terms of the amount of resources that are available with new technologies, we have the latest movie which is not even released somewhere across the world, but we don't have basic mental health issues or basic health issues. Out of 800 channels that are there available on any of the platform to the television viewers, only one is struggling to survive, which is having only health content, a channel called Care. I think as a public broadcaster, Doordarshan did an excellent job. There were some other channels also which carried it out. But today we have cell phones. There are 900 million cell phone users in this world, in this country. Internet is available to almost 350 million at this point of time. Newspapers and digital forms of it is available on the net. So if we were able to just manage this content well, which means in a layered way, empower people to be able to recognize their mental health issues, number one. Guide them to be going to the right sources. We keep talking about only 6,000 psychiatrists, 2,500 psychologists, 1,500 social workers, but we have a vast force of doctors, of physicians, who have not been trained in mental health issues, if we were to take them along. We have more than 6 lakh Ayush workers who are there as a resource, if we can take them along. We have empowered teachers, we have empowered spiritual leaders who can be taken along. And for a large number of people, you do not require extremely sophisticated services. So what can happen if we were to move better as a society is in a tiered way, if we can have people access the services which does not require any rocket science, and then only when they become slightly more disorganized, and incidentally, as Rajesh was saying, that there are stages, and when they see us, they are already in a disorder, but before that there is a stage of dis-ease, and before that there is a stage of distress. So if you were able to pick it up and help people to recognize it, I think that in future, in terms of community psychiatric services, will be what is required. At this point of time, unfortunately, we have lots of people who are in the media. We have talks about public-private partnerships, but that hasn't happened on the ground. And if we were able to do that, possibly in next 5 years, we would be able to take a quantum leap, because if we don't do it in next 10 years, we are doomed as a society.
Thank you.